Welcome to Chemotherapy and You. This is a class geared to provide information for caregivers and patients undergoing chemotherapy. Today's objectives: to inform patients and caregivers about chemotherapy and common associated side effects, to provide information about initial interventions and treatment of common chemotherapy side effects that can be performed at home, to provide guidelines for when to contact the office for patients experiencing side effects from chemotherapy, and to provide resources for patients and caregivers who wish to learn more about cancer treatments and their side effects. For today's class, we will be focusing on intimacy and the side effects associated with intimacy that may occur with chemotherapy. Remember, you may have several side effects, some or none at all. This depends on the type and amount of chemotherapy you receive and how your body reacts. Chemotherapy can lead to sexual changes in men and women, which may impact intimate relationships. In women, chemotherapy may damage the ovaries, leading to decreased hormone levels or even early menopause. Symptoms of decreased hormone production or menopause may include hot flashes, vaginal dryness, irritability, irregular or no menstrual periods at all, bladder or vaginal infections, as well as decreased interest in sex. Within men, they may experience an inability to reach climax, impotence, which is the inability to get or keep an erection, as well as decreased interest in sex. Whether or not you have sexual changes during chemotherapy depends on if you've had these problems before, the type of chemotherapy you're getting, your age, and whether you've had any other illnesses. Some problems, such as the loss of interest in sex, are likely to improve once chemotherapy is over. There are several ways to manage issues regarding intimacy. First, it is very important for you or your partner to avoid becoming pregnant while you are on chemotherapy. Chemotherapy drugs can be harmful to the baby, especially within the first 3 months of pregnancy. Always use protection. For women, if you have not gone through menopause, talk with your doctor or nurse about birth control and ways to keep from getting pregnant. For men, ask if you should use a condom when you have sex, since traces of chemotherapy may be in your semen. If you or your partner have breast cancer, a diaphragm and condoms should be used. Discuss with your doctor any hormone preparations or herbal preparations before use. If you are having difficulty with vaginal dryness, ask your doctor about medications that can be used to make intimacy more comfortable and to help avoid infections. Over-the-counter moisturizers, such as Replens, may be recommended, or non-hormonal compounded creams are available by prescription. You can also use water-based vaginal lubricants, such as KY Jelly or Astroglide, when you have sex. It is important to be open and honest with your spouse or partner and talk to them about your feelings and concerns. If you are having sex less often, try activities that make you feel close to each other and explore new ways to show love. Finally, if you and your spouse or partner are concerned about sexual problems, you may want to talk to someone who can help. This can be a psychiatrist, psychologist, social worker, marriage counselor, sex therapist, or clergy member. Certain types of chemotherapy can cause infertility due to damage to the ovaries in women or damage to the sperm in men. This means that you or your partner may not be able to become pregnant, and this may last the rest of your life. Remember, not all chemotherapy treatments cause infertility. It is important to tell your doctor if you may want to have children in the future before starting treatment. There are programs available that can preserve a woman's eggs or a man's sperm so that pregnancy can be an option after treatment is complete. Remember, fertility specialists may be available as well. As we previously discussed, chemotherapy can be harmful to the baby and may cause birth defects. Make sure that you or your partner does not get pregnant while you are in treatment by undergoing the appropriate precautions. In conclusion, review the drug-specific printed materials provided to you by your physician carefully. Ask questions, and remember, there is no such thing as a stupid question. Be aware that every patient is different. You may experience none of the side effects, some of the side effects, or several of the side effects listed. Keep a notebook or journal of any side effects that you do experience and when they occur. For example, Does fatigue occur 2 days after chemotherapy or nearly 1 week later? Bring this journal to your visits. This may help your doctor to know how to treat your symptoms. Take advantage of offered support groups, patient programs, and educational offerings. And remember, the physicians and staff here at CCI are here to support you through your cancer treatment. Please do not hesitate to call or ask questions if you are uncertain about any side effects that you are experiencing. For more information, please see available online resources listed. And thank you for participating in Chemotherapy and You.